The number of patients suffering from skin diseases like allergies, psoriasis, eczema, vitiligo, pemphigus, lichen planus, skin cancer, etc. is growing. Itching, burning sensation, pain, sores, inflammation, swelling, developing color changes like reddishness, darkening, whitening, bluishness, etc., loss of sensation or pain, etc., are the symptoms of such health conditions. Along with the physical discomforts, the associated mental stress exhausts the patient. Allergies, psoriasis, eczema, vitiligo, pemphigus, lichen planus, skin cancer, etc. are considered lifestyle diseases. However, in the treatment, lifestyle correction is not given the necessary importance. On the other hand, in current medical practice, immunity suppressants like steroids, methotrexate, biologicals, etc. are the treatments provided. Unfortunately, even with the continuous use of such medications, the patients do not get a stable relief. Let us see how eczema, psoriasis, allergic dermatitis, autoimmune dermatitis, etc. can be reversed with lifestyle correction. Health tips are not the focus here. Rather, the effort is on providing information that will help you to understand the causative factors behind this disease, measures for early detection, investigations to assess the impact of disease on different parts of the body, available treatment options in modern medicine with their benefits and limitations. The goal is to help you understand the relationship between the disease and the lifestyle factors. More importantly, to understand the impact of lifestyle correction on reversing the disease process and preventing recurrence. Those who are on medication should remember to reduce or stop medicines only under medical supervision. When we try to understand about about the treatments of skin disease, we should have basic knowledge about the skin structure and how the skin is made. Basically, in our body, around 12 to 15% of the body weight is skin. Actually, it is the protective wall of the body. It is the boundary which decides where you are body and outside. So the surface area of the skin is 1.5 to meters surface area. But if the patient is becoming obese, the surface area also will be increased. This is made, it is not a single layer, it is different layers. Actually, it has mainly 3 layers. The epidermis, the most outside, then the dermis, then the hypodermis or subcutaneous tissue. And if the skin has other small organs like hair follicle, sebaceous glands, that the protective oil is made by the sebaceous gland for the skin, and the sweat glands. Sweat glands is an excretory organ also. So that is having the function of the temperature control. The sweat glands also embedded in the skin, and the nail of the 5 fingers and the 5 feet, toes. That is also now it's a part of the skin actually. Then in the skin, there are other organisms also living. Around 100 species of bacteria or microbes is living in this skin tissue, our skin. That is basically the skin, these microbes are more in the genital area and also the scalp and the axilla. There are more numbers will be there. Around 1,000 species are there. Next, when we consider the functions, what are the functions of the skin? Skin is the protective cover of the body, and it gives protection from the microbes and also ultraviolet rays and other physical and chemical agents like sunlight. It gives water resistance, and it is a cosmetic also. It is a major part in the cosmetic or your appearance or your beauty or the shape of the body. It's all controlled by the skin actually. We are all applying all the cosmetics on the skin. That is another aspect actually. Basically, the health of the skin reflects the health of the body or even the mood. If you are worried or you are happy, it will be reflected on the skin itself. So this cosmetics is applied to make you an even appearance. That is the reason, the purpose of the cosmetic as such. And also the cushioning of the body. If you are sitting, the fat pad of the subcutaneous tissue, the skin, the fat pad is protecting you and giving you a cushion itself actually. If you are becoming too skinny or underweight, that will be reflected on your appearance also, that beauty. And even sitting, you may, if you are very thin, you may feel pain or your buttocks and all, because the bone will be directly exposed to the pressure actually. So it is a protection from the pressures when you are sitting or standing, in every aspect it will be protecting you. And next is a sensory organ. There are many senses. The eyes you can see only, but the skin is touching, is there pressure, pain, temperature, and many sensory receptors are there on the skin. And this nerve endings, it is connected to the brain. Each point of your skin is connected to your sensory part of the brain also, and even the motor neurons are giving. Is connected to the skin. Even this hair follicles have the muscles also inside that. So that is that have motor, and also the autonomic nervous system is connected. Then it has skin has electrolyte, has a main role in the water and electrolyte balance. It is sweat and the temperature control. This all water and electrolyte balance and the temperature is controlled in the body is by the sweat, and also by the sweating you, and even the oil which is produced, sebaceous glands, is actually helping you to excrete the waste materials, or the toxins getting inside can be excreted through the skin. Then it is a production organ. So see, so many functions are there for the skin. It's an endocrine organ actually. It is making the vitamin D from the ultraviolet rays, and also the estrogen, especially for the ladies who are postmenopausal. The estrogen source, the basic primary sex hormone. So it is produced by the skin actually. So excess, if you are overweight with the excess fat in the body, that is especially the subcutaneous fat, there's so much of more estrogen, and that is one of the reasons for the cancer, especially endometrial cancer. One of the reasons is the excess estrogen that is usually happens with the obesity after menopause. Even before menopause also, the body is producing estrogen. If the fat is excess estrogen can be produced. Next is, fat is a storage organ, which is a fat store. Fat is an energy source, so it can be stored in the fat, and also vitamin D and water, all can be stored for some extent. It is it's a storage organ also, especially for the fat and the vitamin D. The fat means is an energy store, and it is an absorption. It can absorb also. Many ointments we are applying, so it can be absorbed through the skin. That's why we are applying on the skin, and also many cosmetic. And this vitamin E therapy and so much of serum therapy and all in the cosmetic field, and it is pressurized to apply on apply on the skin. It may not be much of the part is not absorbed. So this cosmetologist and all apply on this electrical stimulation and so many varieties of stimulation, and even micro aberrations are produced, and then it is applied on the skin to make the absorption increased. And even in the oxygen is 0.5 millimeters of the skin actually is oxygenated directly from the air. So if you are covering the skin with plastic or this thick unairy clothes, so the skin airiness or the skin breathing can be affected. Skin is breathing, we should understand. Next, when we come to the diseases, skin can get all sort of diseases. Like there are different varieties of disease. Like first is the infection, injury and infection. We know that if you get an injury, the microbes can get in and the skin get infected, and also it can go into the blood, and the general infection, systemic infection can come. And that itself, there are different type of microbes, bacteria, fungus, yeast, virus, and any of these infections can affect the skin. It can be directly on the skin, or as a manifestation of the systemic infection, like a chickenpox, smallpox, etc. It can the skin manifestations will be there. The whole body will be affected with fever and pain and all. But on the skin there will be specific blisters and all come. Then another type of disease is metabolic syndrome or metabolic disorders like diabetes, hypertension, dyslipidemia, heart disease, etc. Here also there can be manifestation on the skin. Actually, in the diabetes, especially the type 2 diabetes, first manifestation can be acanthosis nigricans, that is hyperinsulin. When the everyone, generally people think that the reason for the diabetes is insulin is not there sufficiently. It is not. It is the recent research and understanding shows that there is excess insulin in our body, and the first sign of the type 2 diabetes may be the color changes on the skin, especially around the neck, axilla, private parts, and the knuckles, or even when it is extended, it can be in the face. And many of the metabolic disorders like fatty liver and the kidney disease, etc., also can show the signs or the symptoms as the color changes. Another is cholesterol. Cholesterol, if it is increased, and the dyslipidemia, xanthelasma, that is the small fat deposits around the eye. That is a thin, very delicate skin around the eye. Under that, these fat deposits comes. It is called a xanthelasma. And also uric acid, this hyperuric acid condition, the gout. There can be tophies. It is called a tophies actually. Uric acid crystals can be around the joints usually. Then this another type of disease which is affecting the skin is the allergies. It is itching, rashes, and wheal. So that is one of the most suffer one of the very common diseases, allergic skin disorders. And then the drug allergy, that is one of the major problem with the drugs itself. You may not, you think that if I'm taking this medicine for the 2 years or 10 years, 15 years, but after that only sometimes the drug allergy comes. So when you're taking medicine the first time, you are getting itching or rashes, you should think of it's a drug allergy. Or even if you are using it for many years, if you are getting skin rashes, not only rashes or itching, the color changes or some patches or redness or black spots are appearing, then also you should think of it can be because of allergy to your medicine, even if you are taking it for many years. Especially the diabetic medicine, hypertension medicine, you may be using it for many years. But the symptoms of this allergy or the skin manifestation or allergic manifestations can start after many years. And there is a severe form of allergic manifestation for the drug. It is called Stevens-Johnson syndrome. In that the skin rapidly destroying the skin, and not only the skin, the mucous membrane, the mouth and the eyes can be affected. And it is a very serious condition. So if you are continuing the problematic medicine, even if the skin, if you are seeing that problem is there, then you can go into Stevens-Johnson syndrome, and it can even loss of vision. This eye can be affected, and the cornea can be affected, and the vision can be gone. I had seen patients like that. So it's a very severe condition. So everyone should be very careful. If you are taking a medicine and if you are getting allergic reactions, you should immediately contact the doctor and consider stopping the medicine. It is stopping the medicine if the diabetes, sugar or BP may be increasing, but if it is severe, it can be more problematic. So just do not stop the medicine and forget about it. Immediately stop the medicine and consult the doctor and do the necessary things. Next is another group of disease which can affect the skin is the autoimmune disease. Autoimmune disease, the most common what we are seeing is psoriasis, usually affected children and adult. And in small children itself, the eczema, one of the very small children can get affected. And the lichen planus, that is also in more older people, lichen planus. In that actually there will be skin itching, and the central area will be thin and hypopigmentation, that is lightening of the skin will be there. And in the around the area there will be hyperpigmentation and thickening will be there. That is the usual form of lichen planus. And it can not only affect the skin, it can affect the mouth and other mucous membrane also. And another manifestation is this lupus, that is systemic lupus erythematosus. That is usually the initial manifestation may be a pink appearance or the erythematous, reddish erythematous rashes on the cheek. So it's called butterfly rash. That may be one of the sign. And systemic lupus erythematosus means it is not only affecting the skin, it can affect any part of the body, and the liver, blood vessels, and many part can be affected. Another autoimmune disease which can affect the scleroderma. That is also a systemic disease, scleroderma. That is, one manifestation will be the skin, and in that the appearance will be different. It will be the dipping of the skin or the thickening of the skin will be there, and it can gradually turn into ulcers also. In psoriasis, it will be actually the scaling and the reddening and itching and scaling will be there. In eczema, there will be itching and oozing of the skin. Lichen planus, I have explained this thing. And the scleroderma, it is thickening. And by touching itself, thickening of the you can feel. Then different type of rheumatic disorders can manifest in the skin, like hyperpigmentation or hypopigmentation, vitiligo, where the pigmentation, melanocytes are getting damaged and your skin get this white patches will come. Next is cancer. Cancer skin also is very common, especially those who are on the light skin patients or the light skin population like Caucasians, Europeans. And they are more prone for because the darker skin, this darkness is given by the melanocytes. They give a protective barrier from the ultraviolet rays. So actually that is the reason for the tanning. When you are exposed to sunlight, you get the tanning. That is, your melanocytes are producing more melanin, and it is protecting your skin from the ultraviolet rays. That is cancers. Too much exposure can be cancerous, but moderate exposure is needed for the production of the vitamin D. Next disorders affecting the skin is the nail disorders. Nail can get affected. Most of the autoimmune diseases also, especially the psoriatic nail problems can be there. And the hair loss, it is very common with SLE and many autoimmune diseases, and also the patchy hair loss can occur, the autoimmune hair loss. And also sweat glands and saliva, sebaceous glands can be affected. In a severe form, it can be affected. This is hidradenitis suppurativa, that is this autoimmune disease which is affecting the skin appendages like the sweat glands and salivary glands. It is also very painful, especially it will be affecting the axilla, that more hairy areas, and it is very discomforting and very devastating problems actually. Then see, all this disease can affect the skin. If it is infection, we can know that we can treat with antibiotics and all. Whatever is if it is infection or autoimmune disease or the allergy, everything, it is inflammatory disease, even the metabolic syndrome. It is the inflammation of the skin which is actually what is happening. The inflammation and the base of the reason for the inflammation, the agent which is producing, creating problem will be different. So the manifestation will be different. So basically your own inflammation, that means inflammation is the protective aspect of the immune system. It's a protective means a defensive aspect or to protect your skin or the organ from the external agents like microbes or the temperature or ultraviolet rays. That is actually the inflammatory aspect. There is another healing aspect of the immune system is there, anti-inflammatory aspect. Here the inflammatory aspect of the immune system is overworking and the healing aspect is not working properly. That is the problem for all these diseases, all these skin problems. So it will manifest as usually redness or wheal, that is swelling, or pain or redness. That will be the symptom. And the skin, the symptom, another major aspect is the itching. That is when the nerve endings of the at the skin, that is the sensory nerve endings is affected, it will produce itching. Next, what is the cause for this problem? Basically, the infection, we know, the immunity is reduced, you can get the infection. But the immunity is compromised, also you are getting the autoimmune diseases also. In most of these diseases are actually comes under the lifestyle diseases. For that, there is two factors is mainly playing. One is your genetics. If your parents is having autoimmune disease like psoriasis or even atopic dermatitis, your chance of getting will be higher, or your children will getting this disease will be higher. Next is the lifestyle factor. Even if your parents is having the problem, if you are able to find out the ideal lifestyle for you, like the lifestyle means ideal food and less toxic exposure, and if you are managing your body weight ideally, optimally, then the chance of getting the disease will be less. So managing your even if you have a predisposition for a skin disease, if you are managing your lifestyle, you can escape from the manifestation. Next, what are the complications with the skin disorders? Skin is the protective coating of our body. So if the skin is affected, the immune system, actually it is a part of the immune system. The immune system will be stressed. So the bacteria, if there is an ulcer, that means there is microbes are there, or when there is you are itching and getting the skin abrasion, then the bacteria can get inside also. The fungus, virus, anything can go inside, and even the toxins can go inside. So when the complication with this skin disease is the immune system will be compromised, and also for the most of the disease, especially the chronic diseases are of autoimmune origin, like eczema, psoriasis, scleroderma, pemphigus, all these will be treated with the immunosuppressants. So your immunity is fantastic, and there is excess chance of infection because of the abrasion, and you are giving medication which is suppressing your immunity. So when your immunity is suppressed, you can again your chance of getting infection, and also cancer will be increased. That is the problem with all these chronic skin diseases. When we consider about the treatments for the skin diseases and what are the limitations for this, basically for the infection we have very effective antibiotic, antifungals and antiviral medications are there. But if the immunity is compromised, it can recur. But usually, or if we are getting an infection, if you are taking this antibiotics and all, we can get out of it usually, and take good food and optimal nutrition and all, you can improve your immunity. But for the autoimmune diseases, the treatment is very difficult. Anti-allergic also we have very, very good medications. If there is a cause, and if we can find out the cause, or if it is an insect bite and it is creating a problem, or some toxins on the skin, and if you can get rid of that, and there is for the symptomatic relief, for the like itching and burning sensation and wheal formation and all, we can very effectively treat for the time being. But if it is a chronic, like autoimmune urticaria or autoimmune diseases of the skin, like psoriasis, eczema and all, the treatment is very difficult because your own immune system is attacking your skin. And in that case, the modern medicine what is offering is only this immunosuppressants, like steroids or this antimetabolites for the methotrexate, one of the anti-cancer medicine, is very commonly used for the psoriasis, but it is not that effective for the atopic dermatitis. There we will be trying to treat with the steroids itself. And the later generation immunomodulators are there, especially the biologicals. That these biologicals are all specifically focusing on these immunological mediators like leukotrienes. And these proteins, the specific proteins like leukotrienes is made by that certain type of proteins actually they are. So these biologicals are actually blocking the production of it or its action. The productions, the protein kinases are actually inhibitors, protein kinase inhibitors, that is one group of biologicals and immunomodulators. They are actually blocking the production of this attacking units of the inflammatory units. And in the another group is this monoclonal antibodies and all, that is also biologicals. That is every month newer this monoclonal antibodies are coming into the market actually. So that is mainly different aspect of the interleukins. Interleukins are actually this immunological agents actually which is attacking. So we are trying to block it. The problem with this the treatment is actually it's all blocking the immune system. You are trying to block the immune activities on the skin, but it is actually these immune activities are there all over the body. So this inflammatory aspect also is not on the skin alone. It is actually your blood vessels, many organs also will be getting affected. That is why in the autoimmune disease, it is not only the skin, the other organs also get affected. Maybe it is psoriasis in the initial stage, but after some time you will be getting autoimmune arthritis, psoriatic arthritis. Then your nails may be getting affected. Then you are taking on this steroid medicine and all these biological. Then you get as a side effects of the medication itself, you get diabetes, hypertension, other your immunosuppressants. Even you can get other autoimmune diseases and also cancer, because your immunity is reduced. You can go into cancer. So that is the problem. That is the limitation. Even if you are using the medicine, steroids and methotrexate and some other immunological agents like MMF, or there are so many other medications, and even this latest immunomodulators and biologicals also. Even with the costliest, then some of the biologicals which is costing, the newest one will be costing here around 10 to 40,000 rupees per injection. So even if you are using those things, your symptoms may not be under control. That is the problem. Initially, all these agents can give some improvement in the initial stage, but after some time, this will be gone and you will be having the symptoms again. And you may be changing to one to other and going with the multiple medications, and again you will be coming with more and more metabolic disorders also, like diabetes, hypertension, or will be adding with that. So when we consider about the healing of a skin disease, we should consider how this healing occurs. For any disease, the healing has to come when this when the cells are getting damaged, only the disease occurs. When the skin is getting damaged, the skin cells are getting damaged, so new cells has to replace with and remove the older ones or the damaged ones. For the skin, the external layer of the skin, that is called corneocytes. The epidermis itself, there is an external layer called corneocytes. From the epidermis, the basal cells, these corneocytes are developing, and its lifespan is it is actually around 2 to 4 weeks is the timing. So in the psoriasis and all, it takes around 4 weeks for the base cells to come, and its lifespan is over. But in this psoriasis, it is actually within 3-4 days this cell is getting damaged, and life is gone. That is why this flaking and the skin scaling and all is coming. So usual lifespan is 4 weeks, but it is only 3-4 days. It is actually dying. So it is just something like it is a tumor-like reaction. It is happening, but it is not cancerous, but it is a tumor-like fast. That is for the cancer and all the tumors. The cell growth is becoming faster. So that is a problem. So for the healing also, it will take around 4 weeks time. And if the deeper involvement it will take, it will 6 to 8 weeks will be there. That is in the epidermis itself. If it is affecting the dermis or the subcutaneous tissue, it will take more time for the healing. Next, for the hair and the hair follicle also, the time taken will be more. It will be, if for hair loss is there, like autoimmune alopecia, the time for to appear the new hair will take, it will be more time will be taken. So till for this chronic diseases, only the major aspect of treatment is only the immunosuppression. So this will not actually give a permanent solution. So it will be so much of limitation, and the immunosuppression and the infection, cancer, all these possibilities are there. But what is the real solution for these skin problems? Basically, all these are lifestyle diseases. So reverse the lifestyle aspect, which is creating this problem. That is what we have to do. So there is a genetic predisposition and the lifestyle problem. So genetically you may be allergic, or your some food may be intolerant, or some atmospheric factors which can be your body is getting abnormal reaction. For a simple example is gluten allergy. That's a food. It's many people it can tolerate, but many people you cannot tolerate gluten, that is wheat and wheat products and the rye, the oats and many things which contain the protein. Gluten can be making problem for your body. So there can be many other food. That is all, maybe genetic predisposition is there, or there may be the chemicals coming with that food itself, food item itself, like pesticides, preservatives, and the combination when it comes, maybe it is creating problem. So try to minimize the toxins entering in your body and try to find out which food is good for your body, or which food your body can tolerate, which all food, and find out and avoid the other things. And also to ensure the correct nutrition for the body. There are 14 vitamins, 14 minerals, and 4 fatty acids, and out of which 2 are essential fatty acids, and this omega-3 and omega-6 fatty acids. They are actually controlling the immune system for all the autoimmune diseases and all the inflammatory diseases. The inflammation is produced by the omega-6. That is plenty in our common food, like nuts, oil seeds, and cooking oil is filled with the omega-6. But the omega-3, the healing aspect of it, the anti-inflammatory aspect of it, is very low in our food. That is the reason for this increase in the inflammatory diseases and autoimmune diseases. So find out the correct or tolerant, the best food for you, and avoiding this, reducing the omega-6 intake and increasing the omega-3 intake, and reducing the toxin intake and optimizing the nutrition intake is the solution for this. Usually if it is in the beginning, like it's only some little itching or allergy, it is easy for you to control, find out it, most probably the patient itself will be able to. But if it is continuing and you are taking continuously anti-allergens or immunosuppressant, then you won't be able to manage it by yourself. So it is very important that to come out of this medication also. So you may need a clinically supported lifestyle correction, and in that the modern medicine doctors may not be, many of them are, they will be only treating with the medicine. So the modern medicine doctors are trained in treating the medicine with the medicine and surgery, so may not be aware of this sort of management. So only through the basic understanding of how our food and this allergy and immune system and all working, then only you will be able to manage it. So for that you will be needing some support also if you are on multiple medications, or even if you are using diabetic medicines, hypertension, heart disease, and along with that you are getting skin disease also, then also you need clinical support. In short, first, the skin plays a very important role in immune system's defense activities, external threats to the body. Skin diseases reduce the immunity of the body. Second, just as the kidney and liver are excretory organ, so is the skin. Many toxins that the liver and kidney fail to excrete are redirected by the body for the excretion by the skin. Poor skin health will increase the workload of the liver and kidney. Third, very often, color changes, discomforts, and poor skin health are symptoms of internal disease. Diabetes, high cholesterol, autoimmune diseases like SLE, food allergies, drug allergies, cancers, etc. may cause color changes, inflammation, and discomfort, etc. on the skin. Fourth, while taking medication, if there is skin discomfort or change of color, etc., it is very important to consult the doctor immediately and ensure it is not the result of any medication allergy. If such symptoms are neglected, the medication allergy may even progress to destruction of the skin mucous membrane, including the eyes, mouth, etc., to a life-threatening form called Stevens-Johnson syndrome and kidney failure or liver failure, etc. Fifth, chronic autoimmune skin diseases like psoriasis, eczema, scleroderma, pemphigoid, lichen planus, etc. results from excess toxins in the body, consumption of intolerant and allergic foods, imbalance in the quantum and activity of the microorganisms, that is our microbiome, and that is present in the gut and the skin, etc. All of which destabilizes the immune system and create excessive immune response. Sixth, if allergies and autoimmune diseases like psoriasis, scleroderma, SLE, etc. is treated with the immunosuppressants for a long time and not taken efforts for lifestyle correction and reversal of the disease, produces other autoimmune disorders like arthritis, thyroiditis, nephritis, etc., and the cancer possibility also may increase. Seventh, when patients who are on immunosuppressants like steroids, antimetabolites, cancer, drugs like methotrexate, immunomodulators, biologicals, etc., for a long time, if able to identify and correct the anomalies in their lifestyle, they are able to overcome their discomforts and reduce and stop medications. Next, let us understand what is clinically supported and supervised lifestyle correction. In this, the first step is to understand your body parameters by assessing body composition, the lean mass fat mass ratio, body age, fat status, etc. Second step is to evaluate the current status of your organs like a heart, blood vessels, liver, kidney, pancreas, hormones, immune system, toxin level, nutritional status, etc. And also to find out the most suitable food for your body and what to avoid. Third step is to identify what lifestyle modulation can help achieve reversal of disease process, attain desired body composition, and normalize blood parameters. Based on the patient parameters, effort is directed to provide optimal nutrition, physical activity, and reduce toxin level. The focus is to create an enabling environment to balance the metabolic activities at cellular level. In most patients, even those on medication for many years or advise surgery for lifestyle diseases like diabetes, hypertension, heart disease, arthritis, autoimmune diseases, cancer, allergies, etc., can prevent progression of the diseases. To some extent, reverse the damages and come out of most of the medications within a month and avoid surgeries, provided the patient is able to correct lifestyle before the organs are irreversibly damaged. Next, we will see what is the benefit of clinically supported lifestyle correction for this chronic skin diseases. This is a lady, 51 years, height 150 centimeters and weight 60 kg. And she is suffering from psoriasis for the last 22 years. And in India, in our part of the country, Kerala, Kochi, there are so many Ayurveda treatments also available, and also homeo medicines also. The people generally prefer homeo medicine for the this skin sort of problems actually. And also Unani, Siddha and all is available. And this patient has seen so many skin specialists and all these sort of treatments in multiple places she has got. And psoriasis for the last 22 years. And now later she developed thyroiditis also. And migraine also is there for the last 22 years. And again, another one more autoimmune disease, achalasia cardia, that is type 2. She has undergone endoscopy and she has gastric problems, undergone endoscopy and on that also. So multiple problems, and in her problem list also her discomforts are mainly headache and itching. She is not able to get a proper sleep also because of the itching and this gastric problem. So one autoimmune disease means it will be, another will be adding in, but so it is showing. Then we do a detailed analysis of the blood, especially in terms of the parameters, and she is pre-diabetic and other dyslipidemia and all is there. I am not going into the details of the blood report because it will not permit the time. And she with allergy and intolerance, she is allergic to so many food like lemon, sesame, yeast that is used for this baker's yeast, so all this product, and also dal chana, that is it is in our part of the country, it is very favorite dish and it is very nutritious diet actually, dal chana. And lady's finger, that is also she is allergic. And also many other intolerance is there for the milk, egg, mushroom, barley, and so many items. It will be different for each patient. So I am not elaborating into that. This patient is actually also, his vitiligo also is developing actually. I didn't read the, so many problem is there, and varicose vein is also there. So multiple, this varicose vein is also considered an autoimmune disease, and also now the vitiligo is also started. And now the breathing difficulty also there, that maybe her lung also may be getting affected, that interstitial lung disease, that can also appear. And she's taking medication for the thyroid and also immunosuppressants she's taking, but maybe because of the immunosuppressant side effect and also can be there. And now, what is the result with the clinically supported lifestyle correction? In the clinically supported lifestyle correction, we are ensuring that special food is given to, because many of this food is allergic. So, in the natural, just a diet, or a dietitian's advice and all is not sufficient for this. So, to ensure the food, she's getting enough nutrition, give special food, and also for the skin there will be special nutritional oil is given to apply on the skin so that the skin can get it directly also from the food and also from the directly on the skin. And in the 8th day, actually, we get a report from the patient itself from the 8th day, and her headache is reduced, weight reduced 2 kg, and the itching is reduced. And by the 15th, and joint pain, she had some arthritic pain also was there, that also reduced. Then by the 15th day, she's taking only all the immunosuppressants and all is stopped, and only the thyroxine she's taking. Other medicines are stopped, and her itching reduced. The headache, no longer the headache is there. Psoriasis symptoms like scaling is reduced. So it usually takes almost a month for the scaling to completely disappear. By the 30th day, her pain, itching, scaling, this edema, she had edema because of the varicose veins, that all is gone. So that is the difference. Actually, the symptoms and the medication was over by the 30th day. By the 15th day, except the thyroid medicine, all the other medications. Thyroid usually take more because it is very long time thyroid problem is there. It may take some more time for, usually there are this patients will be able to reduce the thyroid medicine and also to stop it also for the thyroid. And we follow up with the autoimmune antibodies for the ATG and AMA also, or the TPO for thyroid patients, and depending on it will be reduced. By the end of the 3 months, she is totally symptom free, and also she is able to reduce her weight to 50 kg. So her height is only 151. Ideally she should reduce again another 45 kg. Then only she will be able to come out of the thyroiditis also. So see this patient she is suffering from with the disease for the last 22 years, the headache and this thyroid, the psoriasis problem, and she has taken multiple treatments, multiple system of medicines, and multiple skin specialists for the psoriasis alone, even for the migraine, for the neurology treatment, and so on. Many she has tried, but she was not getting relief. But within a month itself, with the clinically supported lifestyle correction, she is able to come out of medication, all the medication and the symptoms. So that is the difference. So in our current medical practice, modern medical practice, and even the other systems, I don't know, I'm a modern medical practitioner, so I'm aware of this, and basically we are focusing on the medication and surgery only. The real reason for the problem is lifestyle factors, the food, what is actually making our body. So if you concentrate on your body factors and the genetics, which is the favorable food for you, and what should be about it, that those can be because of the diagnostic developments. We can, by the blood checking itself, we can find out all these matters. And if you are willing for correcting your lifestyle, with that, considering those parameters, you can come out of the most of these lifestyle diseases, especially the psoriasis, eczema and all. You can really control and come out and manage without medication itself, and you can live a symptom-free life also. We will see one more patient with the skin problem, and he is having diabetes and hypertension also. This psoriasis is there for the last 12 years. Actually, his first disease comes hypertension, then diabetes, and the psoriasis started around, diabetes started 17 years back, and the psoriasis 12 years, and now he is having arthritis, and the allergy is there from the childhood itself. Actually, allergy and autoimmune disease actually sisters basically. So allergy, when it is you are maybe taking the anti-allergic agents, and then it is progressing to autoimmune disease or asthma. That is the usual pattern actually. Either continuous chronic allergy will progress to asthma, or progress to this autoimmune disease like a psoriasis. And then I'm not going into the details of the diabetic condition and all. Usually with the diabetes, when the clinically supported lifestyle correction, it's a type 2 diabetes, its insulin level is normal and C-peptide level is normal. Type 2 diabetes, we stop the diabetic medicines on the first day itself, and the hypertension medicines we stop on the, according to the, we monitor the blood pressure at home and stop when it is, usually with the clinically supported lifestyle correction, within few days itself, within 1 or 2 days itself, the BP will come down, and stop the diabetic BP medicine also, taper of BP medicine. The diabetic medicine type 2, stop in the initially itself. Otherwise we are giving a low calorie diet with nutrition and all, because most of these patients also, if it is obesity or excess fat is there, we have to get rid of the fat also. So you need a low calorie diet. Low calorie diet, if the low carbohydrate, if you are taking diabetic medicine, you may get into hypoglycemia and all. So we stop the diabetes medicines and monitor the BP at home. So in the 8th day, this patient actually, no medicine for the diabetes, BP medicine also reduced. And there is, he had this numbness and neuropathy symptoms also on the leg, that is reduced. Itching is reduced. Weight reduced to 2.1 kg, and pain in hand and leg also reduced. So by the 15th day, the patient, again weight reduction is there, another 1 kg reduced, no medicine, and almost no symptoms, only some slight pain on the foot. Actually itching is gone completely. Only thing, the psoriatic, this scaling also is reduced almost fully. Scaling is not there. The lesions are there, some redness and the thickening and the patches and all is there. But otherwise the problems are over. Usually that is the healing time will take, that skin lesion has to go, it will take 2 or 3 months actually. So by 30th day he is almost symptom free and no medication, and by he was starting, it was 58 kg was there, by 90 days he reduced to 52 kg. So almost symptom free. And here also this patient also had so many food items for allergic. He's also dalchana. Dalchana is a very favorite food of the in Kerala and all. In India itself, it is a very commonly used nutritious food actually, that are very high protein. But it is almost, I think, around 15 to 18% of the people are allergic to it. So those who are having this autoimmune disease should be careful about such food. And also he is allergic to many other items like milk, potato, and it will be different for many people. So we will, I'm not going into the details of this patient. So each patient has to be managed differently. And if you are willing for to understand this lifestyle correction and work accordingly, work together, then you can definitely come out of all these diseases itself and also medication. So that this, if you are avoiding the immunosuppressants, then it is, your immunity will be, without if you are stopped immunosuppressants only, you can recover your immune system and lead a healthy life. He is not coming out of the psoriasis alone. He is able to come out of diabetes, hypertension, and also diabetic neuropathy and arthritis sort of. I'm not actually, most of the patients will be having many diseases, not only 1 or 2, maybe so many diseases will be there. The advantage of this is this clinically supported lifestyle, the body is getting corrected. So you can come out of all the diseases in the same pattern. But with the modern medicine, or any other medication, you have to take medication for each disease, each symptoms. Actually, the symptomatic treatment is given here, but the immunosuppression will give more additional problems also. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of the toxins by improving circulation through optimal stimulation of all cells by the plant exercise. Third, minimizing toxin entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicine and 90% of the surgeries can be avoided it is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication nor surgery that created the disease. This is why once medication is started, very often both the disease and medications will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about the healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kochi as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service. Later resigned from the government service and in 1997 started practicing as consultant at Life Care Center, Kochi, focusing on lifestyle modulation with the clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medication we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect our children, grandchildren and the coming generations from the ill effects of the toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends and colleagues who are on chronic medication or planning surgery for lifestyle diseases. The last few decades of modern medical management clearly shows that medication and surgery cannot cure most lifestyle diseases. A reliable and sustainable solution lies in the lifestyle modulation. To know more about different lifestyle diseases, treatment options, a reversal of the lifestyle diseases with a clinically supported lifestyle correction, etc., you may visit our YouTube healthcare channel. Thank you.